The lungs are a pair of spongy, air-filled organs located on either side of the chest. They are an essential part of the respiratory system, working to take in oxygen and release carbon dioxide with each breath. The left lung is slightly smaller than the right lung to make room for the heart. The lungs are enclosed by the rib cage and protected by the pleura, a thin membrane that also lines the inside of the chest cavity. The main function of the lungs is gas exchange. When we breathe in, air enters through the mouth and nose, traveling down the trachea and into the bronchi, which are airways that branch off into each lung. Within the lungs, the bronchi continue to divide into smaller and smaller branches called bronchioles. At the end of each bronchiole are tiny grape-like clusters of air sacs known as alveoli. It is within the alveoli that the vital process of gas exchange occurs. The alveoli have thin walls surrounded by a network of tiny blood vessels called capillaries. Oxygen from the inhaled air diffuses through the alveoli walls into the bloodstream, while carbon dioxide diffuses from the blood into the alveoli to be exhaled out. A healthy lung is sterile and has defense mechanisms to prevent infections. Tiny hairs called cilia line the trachea and bronchi, working to trap debris, bacteria, viruses, and other foreign particles. The cilia move in a sweeping motion to push the mucus towards the throat where it can be coughed out or swallowed. Alveolar macrophages also reside in the alveoli, engulfing and destroying bacteria and viruses. Despite these protective mechanisms, infections can still occur in the lungs. Lung infections, also called respiratory infections, can affect any part of the respiratory system. They are generally caused by viruses, bacteria, or fungi. Viral infections include influenza, coronavirus, respiratory syncytial virus, RSV, and adenovirus. Common bacterial lung infections include bronchitis, pneumonia, tuberculosis, and pertussis, whooping cough. Fungal infections like histoplasmosis and coccidioidomycosis are less common but can be serious. Lung infections can range from mild to life-threatening. Milder infections like viral bronchitis may only cause coughing, sneezing, and chest discomfort. More serious infections like pneumonia can involve high fevers, shaking chills, difficult and rapid breathing, chest pain, and coughing up sputum. Some key complications of lung infections include respiratory failure, lung abscess, and the spread of infection to other organs. Prompt medical treatment is crucial, but there are also many natural remedies that can help treat lung infections. Number 1. Steam inhalation. Inhaling warm, moist air can provide relief for infected lungs by loosening mucus, soothing inflamed airways, and easing coughing. Add a few drops of essential oils like eucalyptus or peppermint to maximize the benefits. Breathe in the steam for 10 minutes 2 to 3 times per day. Keep a towel draped over your head when inhaling the steam and take care not to burn yourself. This is a safe, easy home remedy suitable for both children and adults. Number 2. Honey. Honey has powerful antimicrobial and anti-inflammatory properties that make it ideal for treating lung infections. It coats and soothes the throat while also attacking bacteria and viruses that cause infection. Drink a warm cup of honey lemon water 2 to 3 times per day or mix honey with tea. For coughs, take a teaspoon of raw honey straight or make a DIY cough syrup by mixing honey with warm water and a squeeze of lemon juice. Honey should never be given to children under 12 months old due to the risk of infant botulism. 3. Ginger. Ginger has a long history of use in treating coughs, colds, and chest congestion. It acts as a natural expectorant, helping to loosen and expel mucus. The anti-inflammatory compounds called gingerols are also beneficial for reducing inflammation in the airways. Make ginger tea by steeping slices of fresh ginger in hot water. Drink up to 3 cups per day. You can also take ginger supplements in capsule form or have ginger shots if you can stand the spicy heat. Number 4. Garlic. Garlic possesses antiviral, antibacterial, and antifungal properties that make it a powerhouse remedy for lung infections. It may also boost the disease-fighting ability of white blood cells. Eat 2 to 3 cloves of fresh garlic per day, ideally raw for maximum benefits. You can crush or chop the cloves and swallow with water like a pill. Cooking garlic may reduce some of its benefits. Garlic capsules or extracts are also available in supplement form. Number 5. Turmeric. The active compound curcumin in turmeric has been shown in studies to have strong anti-inflammatory and antimicrobial effects. For lung infections, turmeric may help inhibit the growth of bacteria and viruses while reducing swelling and mucus production in the airways. Add 1 teaspoon of turmeric powder per day to food and smoothies. Turmeric tea and capsules are other options. Combine turmeric with black pepper to increase absorption. Number 6. Eucalyptus oil. Eucalyptus oil is often used in cough drops and chest rubs thanks to its expectorant, anti-inflammatory, and antimicrobial properties. For lung infections, the aroma of eucalyptus can help loosen mucus and ease congestion. Add a few drops to hot water or baths and inhale the steam. Dilute eucalyptus with a carrier oil before applying to the chest. Use this potent oil cautiously and always diluted. It should not be ingested or used on or around children and infants. Number 7. Peppermint. The menthol in peppermint provides a cooling sensation that can relieve sore throats and coughs. Peppermint also has antimicrobial activity against certain bacteria and viruses that cause respiratory infections. Drink peppermint tea up to 3 times per day. Try adding a drop of peppermint essential oil to hot water or honey for inhalation. Peppermint capsules are another option, but avoid giving peppermint products to young children. Number 8. Bone broth. Warm, nourishing bone broth is the ultimate food remedy for lung infections. It starves bacteria while providing electrolytes, minerals, and easy-to-digest nutrients for the body. Bone broth may also help thin out mucus. Simmer chicken or beef bones for at least 12 to 24 hours, then sip the broth throughout the day. You can add garlic, onions, ginger, turmeric, and other herbs and spices for extra immune-boosting power. Number 9. Olive leaf extract. Olive leaf extract has traditionally been used to treat respiratory conditions thanks to its antiviral, antimicrobial, and anti-inflammatory properties. A key active compound called oleuropein is thought to disrupt the life cycle of viruses and inhibit bacterial growth. As a supplement, take 500 to 1,000 milligrams of olive leaf extract up to 3 times per day. Check with your doctor before use, especially if taking other medications or supplements. Number 10. Vitamin C. Many respiratory infections can rapidly deplete vitamin C reserves. Megadosing vitamin C supplements may help shorten the duration of lung infections by boosting the immune system. Take up to 2,000 milligrams of vitamin C supplement per day, spread out into smaller doses. Vitamin C is water-soluble, so excess amounts will be excreted in urine. Avoid megadosing vitamin C if you have kidney stones or issues. Food sources like oranges, grapefruit, and capsicum are also excellent. Lung infections are a common affliction that can arise from a variety of bacteria, viruses, and fungi. They range from mild chest colds to life-threatening pneumonia. While antibiotics are often necessary for serious bacterial lung infections, there are also many natural remedies that can support the healing process. The home remedies discussed in this video may help fight infection, reduce inflammation, loosen mucus, ease coughs, and support lung health. Options like steam inhalation, bone broth, honey, and essential oils are generally safe for both children and adults. Herbal remedies like ginger, garlic, olive leaf extract, and turmeric have antimicrobial and anti-inflammatory properties that may help inhibit the growth of viruses and bacteria. Keep in mind that herbs can interact with medications, so check with your pharmacist or doctor. Implementing some of these natural remedies alongside doctor-prescribed medication can help you recover faster from a lung infection. However, it's important not to rely solely on home remedies to treat severe lung infections that require antibiotics or hospitalization. Be sure to watch out for symptoms like high fevers, difficulty breathing, chest pain, and coughing up blood that warrant prompt medical attention. The prevention of lung infections is also key. Get an annual flu shot, practice good hygiene, stop smoking, avoid air pollution, and work to keep your immune system healthy through diet, exercise, sleep, and stress management. Staying hydrated, using a humidifier during cold weather, and doing regular airway clearance techniques like postural drainage can also help prevent respiratory infections for some people. Being proactive helps reduce your chances of getting a lung infection in the first place. Many of these natural remedies also work as effective symptom relievers for milder respiratory complaints like seasonal allergies, colds, sore throats, and coughs. Next time you feel chest congestion coming on, opt for honey in tea, a steamy eucalyptus bath, bone broth, or other natural therapies to find fast relief. Implementing more of these antimicrobial and anti-inflammatory foods, herbs, essential oils, and supplements into your routine is a wise way to keep your lungs healthy and prepared to fight infection. Though a lung infection can be debilitating, nature provides us with many ways to prevent and treat these disruptive respiratory ailments. Thank you for watching my video on the top 10 natural lung infection treatments and home remedies. I hope you found this information helpful. As discussed, lung infections like pneumonia, bronchitis, tuberculosis, and more can definitely take a toll. While antibiotics play an important role in treating bacterial lung infections, there are also many natural remedies that can support your recovery and ease those unpleasant respiratory symptoms. Options like steam, bone broth, honey, essential oils, garlic, turmeric, olive leaf extract, vitamin C, and more have antimicrobial, anti-inflammatory, and mucus-clearing properties to help treat lung infections. Even making small additions like a daily cup of honey lemon tea or some garlic in your meals can make a difference in fighting off viruses, bacteria, inflammation, and congestion when you're under the weather. Of course, always speak to your doctor if your symptoms persist or worsen. Please let me know in the comments if you found this video helpful, or if you have a go-to home remedy for lung infections that I didn't mention. Your engagement helps this channel grow. I look forward to sharing more natural health and wellness content with you all soon. Thanks so much for watching, take care, and I'll see you in the next video.